Thank you, Dr. Sears, for joining us today to share some valuable information about wireless radiation and environmental health, scientific and health perspectives. Dr. Sears has advanced environmental health for decades, and as chair of Prevent Cancer Now, she works to make least toxic the norm. She was also a founding member of the Wetlands Preservation Group of West Carleton, Coalition for a Healthy Ottawa, Canadian Coalition for Human Health and the Environment, and Waste Watch Ottawa. Meg was trained in chemical engineering and applied chemistry at the University of Toronto and biochemical engineering with her PhD from McGill. And she has diverse laboratory experience, including energy research. With skills in scientific analysis and writing, she gained associations with medical researchers. Some highlights include the medical perspective on environmental sensitivities for the Canadian Human Rights Commission, leading to a policy under the Canadian Human Rights Act, a Canadian Institutes of Health Research, CIHR, and Social Sciences and Humanities Research Council, SHRC, funded review of environmental, public health, and medical approaches for toxic elements, free guidance documents addressing multiple chemical sensitivities, indoor environments, including wireless radiation, and COVID-19 with the Canadian Committee on Indoor Air Quality, CCIAQ, and rich collaborations with Canadian Environmental Health and Policy Organization. Meg has advanced safer telecommunications in the CCIAQ module number 14 and worked with Environmental Health Trust and C4ST co-authoring scientific papers, addressing decision makers and presenting in academic and public fora. Thank you so much, Dr. Sears, for joining us this evening.
Thank you so much for your very generous and kind invitation. It's a thrill to be here with all of these very knowledgeable people. And so I hope I can add a little bit of an angle from my background, originally in chemistry. So a lot of people think about physics because it was the physicists who were studying radiation and who figured out how to do all of these telecommunications. And now we have wireless devices that they're revolutionary, changing the world, literally. But they are addictive, they are omnipresent, and these modulated, pulsed, complex signals, they are biologically active, and they affect all species, and they are not safe, that four-letter word, safe. But we have information technologies that can often be used with wire or fiber connections instead of wireless connections. And some apps and functions do not require any kind of connection. So my background here is that Prevent Cancer Now aims to stop cancer before it starts. So we look for the background and approaches to knowledge. And we, our expertise is not only what we know, but how we figure things out. And we recognize that in this very complex world and complex desires and types of knowledge and ways of knowing, there are a lot of uncertainties. And in terms of cancer prevention, really it's considerations for public health. So when it comes to wireless radiation, wireless telecommunications, I think that we have a lot of experts who are looking at this elephant in very, very different ways. So we have, just like the fellow on the back who thinks that the elephant feeling his ears is like a fan, or the blind man touching his trunk, his tusk is like a spear, or his trunk is like a snake, or his leg is like a tree. Everybody with their own point of view is looking at the same thing or examining the same thing. They're not looking at it because they're blindfolded, and they have very different impressions and different ways of knowing. So when we come to wireless telecommunications, I think it's a lot like this, honestly. We have the physicists who look at the radiation and the particles and how things interfere and how we can translate signals into comprehensible messages. We have engineers who make what the physicists envision and design work. And then we have the biologists who say, things are kind of going sideways here because people are being affected and the ecospheres are being affected. It's, this is very potent stuff and we don't really understand it. And then the medical experts say, we are seeing sick people. And the biologists are having a hard time really explaining things to us completely. So they work together and we recognize basically that this is a type of signal that we are using. It's very, very effective and helpful in many, many ways, but we have to understand much better what it's doing to physiology. And then we have the citizens who are saying, oh my goodness, I just can't stand this because this Wi-Fi makes me sick. And up until now, we haven't seen what the chemists think. So that's that's really the reason that I'm here today, is because I was originally trained in chemistry. And back in 1977, I believe it was the first time that I heard about how what we are now using for telecommunications could affect chemistry. But first, we'll just very briefly go through the thinking to date. We have regulators who compile all sorts of information from various experts, and the regulators have to come to a standard of consistent, convincing evidence of significant harms before they do much of anything. They have animal studies and people studies, and then they have to replicate and understand what they're seeing in organisms in terms of biochemistry and symptoms and diseases such as cancer. And we have a typical storyline with all of these regulated, harmful exposures, be they lead in gasoline and lead in water or asbestos, that harms emerge over time. They are contested. The regulators, the industries say, no, my pet, whatever it is, chemical or technology, couldn't possibly be harmful. You're just sending us back to the dark ages, and that's completely not true. And then there is a subtext of industry capture, where the industries are, kind of in the back rooms with the regulators. And there are many, many stories and books and, authoritative after the fact analyses of how things have taken way too long to regulate. And in the interim, there is public health harms. So as I mentioned, the physicists, they started off, they, found out about wave particle duality and the spectrum and how radioactivity is a little bit like the radiation that we have at very low frequencies. And then they distinguish them by saying, well, this radioactivity is from, from nuclear radiation and so on, that's different, and that causes ionization. And so they erected this artificial barrier between ionizing radiation and non-ionizing radiation, and we're still kind of working with that. But radar and radio, they're not ionizing radiation, so and that's really what we're fighting today. And now we've got modern two-way telecommunications for voice and data, and our exposures have gone up many, many orders of magnitude just in my lifetime. And then we have experimental biologists. So this is an interesting, this is from an interesting study that was by Thielens back in 2018. And the idea is that the frequency of the radiation is inversely proportional to the wavelength. And if the wavelength is really, really long, it's sort of like a wave that washes over you and it doesn't really affect you. But once the wavelength starts to get shorter and is comparable to, in this case, the size of insects, then you can get specific and quite dramatic damage or interactions with as a result of the size. So this is modeling and showing that types of radiation that we are using for telecommunications could have very specific and otherwise unanticipated effects on insects of particular sizes. So we're starting to understand in greater detail some of how this radiation can interact with living creatures. And of course, insects have an exoskeleton, which added another interest to that. But then when we look at not just one insect, but our biosphere, there was a tremendous series of studies that were pulled together by Levitt, Lyon, Manville. And first of all, they described these orders of magnitude of increasing EMFs and how species interact with EMFs. You know, we have these specific reactions with insects, and then other effects on, depending upon the structures in animals. And then they discuss how the exposure standards and the public policy and the laws are not really coping with these complexities, and they recommend changes. And in particular, the major change is to vastly reduce this type of exposure. And they said that there are biological effects across all taxa and all frequencies at low intensities. And they see biological effects at ambient temperature exposures that we would see today. They also said something that was just kind of interesting, was that there are a lot of unique physiologies, and some species of flora and fauna are exquisitely sensitive to this exogenous EMF in ways that may surpass human reactivity. So we can't just protect ourselves. We have to be thinking about protecting all species. And so they describe these effects on wildlife, such as on orientation and migration, as an experiment with birds that were either exposed to cell tower radiation or shielded from it in a park. Once they released the birds who had not been in the fields from the cell phone towers, they set off on their migration as perfectly normally. And the birds that had spent time in this unshielded cotton tent, they vanished off in all different directions because somehow this had affected their direction finding. Animals had trouble finding food. There were reproductive problems and mating difficulties. They were kind of disorganized and not able to properly build nests or dens. And there were changes in the way they maintained their territories, they defended their territories, and it affected longevity and survivorship. And they also noted that there were genotoxic and cellular toxic, cytotoxic effects. And as biologists, they put out a made a heartfelt statement that wildlife loss is often unseen and undocumented until Basically, it's the last minute until tipping points are reached. And during the biodiversity conference that was held in Montreal, there were some websites put up by Prevent Cancer Now and C4ST, and also by Environmental Health Trust, who also has now a website on agriculture. So if you get the slides, you'll be able to see that there has been a lot of interest in the biological effects more broadly than just people. Now we have physicians who are very interested, obviously, in people, and they are clinically experienced, and they are having people come to them saying, I have these effects. I can't live with wireless radiation. There's pain and loss of strength and loss of stamina. Their nervous system is impaired, not only in their abilities to move and so on, but also in their thinking, and their cardiac problems, and there are a lot of biochemical changes. And now we see that both in humans and in animals, wireless radiation is a probable or a known human carcinogen. So at Prevent Cancer Now, as might be guessed from our name, we focus on prevention and minimizing wireless radiation in the environment, and from devices and toys to protect children, and including and especially in utero, which is sometimes not really thought of as much for radio frequency radiation. Then we move on to the epidemiologists. And so they basically say, does wireless radiation cause adverse effects? And there's a big focus on cancer. So today, right now, the International Commission on Biological Effects of EMFs, ICB EMF, they've laid out the evidence to date, and they conclude that yes, it's a human carcinogen. And the WHO sponsored review that was very recently published by Mavisian et al., they found that 2 tumor types with high certainty of evidence in animals as a result of exposure to radiofrequency radiation. And these 2 tumor types are the same as were identified by the IARC working group and by ICB EMF. And those are glioma in the brain and the schwannoma in the heart. So we have animal studies, human studies, the same tumors in both. So it's looking as if, yes, this can cause cancer, and it does cause cancer. And so we say, how does this work? How do non-ionizing EMFs affect biochemistry to cause chronic illness, disability, and cancer? So we have bioassays that show oxidative stress, oxidative changes in biochemistry, damage to membranes, DNA damage. But again, this is non-ionizing. Why does this occur? And nobody asked the chemist yet. So this is why, this is the main point I'm bringing to the table today, that chemistry finds that EMFs lower activation energy for chemical reactions. And so therefore, it is completely expected that we would have different reactions that could lead to all of these changes in biochemistry simply as a result of this effect of EMFs on the catalysis so you'll see on the screen that there's an activation energy. Basically, a chemical reaction is where you take your rock, your mixture, and you take it from one state to another. But there's always, in order to have a stable condition, there's always an activation energy to get from one place to another. So basically, you have to get over that activation energy in order to have a chemical reaction occur. And there are millions of chemical reactions going on constantly in everybody's body. Every one of them has an activation energy. Every single chemical reaction in your body possibly could have its activation energy affected by radiofrequency radiation. So this is put a little bit more elegantly in, and this is from a textbook on microwave radiation that says it can increase the rate of enzyme catalyzed reactions in organic media. So that's in, they may have some water in it, but there's other organic things like oils or lipids, possibly tiny little lipid droplets in a solution. And so now we know that it is false that only ionizing radiation affects biochemistry. Our harms are heating, which is established, and that's the basis of regulation of our wireless devices. But with microwave radiation, biochemical reactions are different. They're faster. And this has been observed especially in mixtures that are considered less polar. And so water is a very polar mixture. Oil is not. And sometimes if you blend water and oil, you'll get these very tiny droplets. And in cells, we have enzymes that are lined up along on membranes, which are also lipid. So in this kind of situation, we're sort of mimicking a biochemical situation where you've got enzymes that will embed themselves in these tiny little droplets, and then you can put in whatever it is that you want to be catalyzing, be having your chemical reaction increased in rate. And there have been peer-reviewed reports since the 1980s on microwave chemistry, including with very tiny bits of heating. So this is the, not sure if you can see the arrow. This is the activation energy without microwave radiation. But if we have microwave radiation helping out, we have this very low activation energy. So these reactions go much more easily, and they're unusual reactions. They're not the normal biochemistry. And this is why we find that with microwave radiation, the biology kind of goes awry, frankly. So there's a textbook called Microwave Catalysis in Current Microwave Chemistry. And they have documented these faster biochemical reactions with low-level microwave radiation. And it's actually been applied. So it's got commercial, it's commercially applied, and people make money out of this effect. For instance, there's a medical test, and so you get a higher rate for this medical test. So the medical test develops, and you've got your results a lot sooner. For instance, there's an immunoglobulin G test that if you simply mix it together and leave it on the counter, it takes, basically a day. It's something you would report from the lab the next day. But if you use microwave radiation, you can report back to the doctor, report back to the patient within minutes. So this has been applied. It's a real thing. They've observed faster protein unfolding when in vitro, and also there's been changes in the specificity of enzymatic reactions. So if you have the precursor and then your enzyme, and you have your reaction under normal circumstances, you would get one product, but when microwave chemistry is being conducted, the product may be a little bit different. There may be one more atom or one group that is left behind or is removed. And so you end up actually with a different chemical at the end, just because of having this microwave radiation there. Same chemicals, same enzymes, different product. So, and if this is happening in your body, that's not going to be very healthy. They're also, they've also observed with microbes, increased rates of biosyntheses. So there's this vast body of knowledge about what microwaves can do in basic chemistry. So what would that mean in your body? And this is just one example. Your body is running, it is growing, it is metabolizing, it's keeping you warm, it's keeping your brain going, it's allowing you to move your muscles and to digest and breathe, etc. Because of a very large number of chemical reactions. Every single one of those chemical reactions has an enzyme that is catalyzing it. This is one example that if you took biology in grade 12 or so, you probably remember the Krebs cycle. This is a fundamental cycle in all mammals and higher animals. And it is carried out in the mitochondria, which is a tiny little is a tiny little section of every cell in your body. So if you've got this number of enzymes, this number of chemical reactions that are all synchronized, they're all meant to go one after the other, and this is providing the energy for your growth, for your metabolism, for you to live. And then some of these chemical reactions are messed up. You can understand that this is very, very fundamental. So microwave radiation is changing the biochemistry very fundamentally. And so to say that it is unthinkable that it has any effect, really it's unthinkable that it would not have an effect. It would obviously have an effect. So this is increasingly an important part of our everyday environment. So that kind of wraps it up on the biochemistry end of it. And so I'm going to move from having an effect to what kind of effects we're having. And in this case, when we have a response, which may be, maybe a disease, and such as leukemia or bone or bone cancer, liver cancer, other cancers, or and we've got incident radiation or ionizing radiation from internal sources. That would be from breathing dust from a nuclear reactor or something like that. There are two models of how that might be those diseases might develop. And the popular one that we will hear from industry is that there is a threshold. So our body can cope with a certain amount of radiation, a certain amount of toxic chemicals, a certain amount of whatever the adverse effect is. And then after a certain point, then this exposure is going to start to increase the response, increase the number of cancers, increase the number of people who are disabled, whatever. So that's the industry's favorite dose response. It's considered to be more prudent if you are considering regulations to consider a linear no threshold response, basically a no threshold. So even if you have a minuscule little increase in whatever the adverse exposure is, there will be a small response. And then as the amount of exposure goes up, the response is also going to go up. And this is sort of coordinated. So those are two rather outdated theories. One, the linear threshold is that came first, and then people said, well, it's going to go even a little bit may be harmful. So to be protective and so on, we'd better be a little bit more sort of truthful about it. But what we actually find is, there we go. These are this is the kind of dose response that we actually see in real life. We see it for lead and childhood IQ. We see it for chemical and radiation exposures and for cancers. And the idea is that even with a very tiny bit, there is a disproportionately high increase in the in whatever the outcome is. So this is a graph of benzene and leukemia. And so even if you are exposed to a small amount of benzene, you've got quite a remarkably higher risk of getting leukemia. And then once the exposure gets to be much higher, then that response is not as as severe incrementally. So this model means that it is very, very important to minimize what the adverse exposure is. And we see this pattern not only for benzene leukemia, we see it in many different types of exposures and adverse outcomes. And this is the type of exposure pattern, the no safe dose and the greatest marginal harm at lowest doses, that we would expect to see from radiofrequency radiation. And certainly we've got no proof otherwise, but this is a pattern that is increasingly being seen by epidemiologists. And so this really just means we really want to drive the exposure to a minimum. But if all you're doing is looking at, sort of the zero and then comparing it to here, you're kind of assuming that not much is happening down at this level. So it gives you a model that is less likely to be pushing at public health considerations. So what are we going to do? If the federal radiofrequency limits protect only against overheating, I think we can do better than don't cook the kids. So if you consider that speed limits in Ontario towns are 50 kilometers an hour, and we also protect children near daycares, schools, and communities with slower speed limits, don't children also need and deserve as low as reasonably achievable? Shouldn't we be driving that exposure down as low as we possibly can to protect our children? I do. And I really applaud the many, many people who are working on that. And it isn't as if we don't have choices. There are lots of wise solutions. There are lots of different kinds of wired connections and ways that we can be mostly using wired technologies. And I think that we're going to find that there are going to be some very clever inventors who figure out even better ways to communicate without basically irradiating the landscape. But, this is one tower that was actually denied at one point, although I'm not sure. These issues never go away. They simply lurk. but, should we be building enormous towers, recognizing that there are going to be some antennas and more antennas will be added, and that there will be more structures, and this will be near people? Or as some of the people who are advertising fiber optic cable, they say, don't get left in the digital dust. And we have options already. And this is what should be in our schools and in our homes. This is what should be in planned communities, in all of the big buildings. So if we minimize electromagnetic radiation at home and schools and workplaces, we know that wired connections are safer and faster. They require less energy, they're more secure. In fact, I'm living in Ottawa, or on the outskirts of Ottawa, and in the buildings downtown, the colleague was working for Health Canada. He couldn't even use his cell phone in his office. There was no wireless. It's not secure. And outdoors with climate change and so on, a buried fiber is protected from severe weather. All of these communication towers, they come tumbling down in tornadoes. We had one here in Dunrobin. We now have evidence that students in low EMR and phone-free classrooms, they learn better, they socialize better, they work with their friends. And so we can work together locally for our schools and local organizations. There is a lot of interest now in delaying giving kids phones, not till high school is a good aim. And of course, there are all sorts of plug-in cords and cables and adapters that can be used. This kind of technology, it has been developing very quickly, and I've got no doubt that it's quite possible for it to develop very much safer modes of application right now. And of course, phone-free times, Wi-Fi free times, and certainly Wi-Fi free long times, maybe Wi-Fi without, but staying away from internet technology is probably good. Lots of times in classrooms, during meal times, overnight for better sleep. And so we can get away from all of this artificial intelligence, celebrate books and real life experiences. We can get real, go for a walk, dig in the dirt, dig the snowbanks around here. The snowbanks are so big. Hold small creatures in your hands and wade in the water, go for adventures with friends, get your hands dirty. And none of these formative experiences for kids can be matched on screens. So I hope you've learned a little bit about chemistry and are invigorated a little bit more to take even more steps, although I know you're doing a heck of a lot. And I have to thank you very much for this opportunity to share some time together. So be kind and stay safe. And as there are some publications that I did, so if people are going to access the slide deck, then they'll also get a select collection of some of my publications. So thank you again, and we'll stop sharing. And I look forward to talking now.
Thank
Your
you so
turn.
much. Thank you so much, Dr. Meg Sears. If everyone can stay muted just for the closing, that would be great. I just want to say thank you for your valuable scientific review and insights into the next steps for progressive public health policies. We've learned from your presentation that experts across disciplines warn that low-level EMF can cause biological harm, including cancer. Ecologists note that wildlife may be more sensitive than humans, with impacts often unseen, underscoring the need to regulate EMFs as an environmental pollutant. As you eloquently summarized, engineers and chemists report that Athermal microwave radiation can accelerate enzyme activity and alter protein unfolding, and biochemists report on disruptions in the biological timing of the Krebs cycle in mitochondria. Evidence indicates there is no safe dose, with the greatest harm occurring at the lowest exposure levels. So reviews by ICBE, EMF, and WHO-sponsored studies identify consistent tumor findings in humans and animals, including glaucoma and cardiac schwannoma. In conclusion, there is no safe dose. The greatest marginal harm occurs at the lowest doses. As you reported, prevention is critical. Applying the Allura principle means minimizing wireless radiation, prioritizing wired and fiber connections, and protecting fetuses, children, medically vulnerable individuals, and seniors. Communities play a key role by promoting safe technology practices, engaging policymakers, and supporting hands-on learning and outdoor activities that cannot be replaced, as you said, by screens. It's up to us to raise safe tech awareness in our homes and school communities, to promote wiser wired connections, to have conversations with neighbors and local politicians, including MPs. Hands-on writing, print-based learning, and outdoor exploration are essential to healthy childhood development and educational achievement. These experiences are fundamental to healthy childhood, long-term educational success. They build skills and capacities that cannot be replicated or replaced by screen-based learning. Thank you so much, Dr. Sears, for that beautiful presentation.
Thank you very much.